Hi everyone. In this lecture, we will discuss about the 6 points. This all 6 points have been appeared in NEET MDS as I have studied all the papers of the last years. So the first one is Lee Clark's procedure. Before explaining this procedure, I just want to explain one thing. Once what happened in my clinic is a patient came, okay, and I have been doing some surgical treatment into his mouth. Automatically what happened, the TMJ dislocated anteriorly. I got scared, but the person was so casual, so usual. He just opened his mouth and can adjust his TMJ, as means he, it is not a different thing for him. So I just asked him that how it has happened. He just explained me about a bad experience due to long procedure into a dentist. He got this problem. Okay, so I got into this theory. This is, and for this thing we do, for this case, okay, the treatment is Lee Clark's procedure. I wish you have understood the thing. For example, I just give you example. This is a TMJ. For normal procedure, it's a habitual, okay? It's a habitual procedure of anterior displacement of TMJ. Okay, it is, these are all the indications. First indication, okay. Second indication is your anxiety to dislocation. Third is your excessive salivation, means mainly this is the reason, okay. Excessive salivation or your anxiety comes from this part, okay, and the treatment is this, right? So what happened is this is known as a habitual TMJ dislocation. This process is given in 1943. This process is given in 1943. A Swiss dentist gave this process. It is a surgical procedure in which the zygomatic arch was vertically ostomised. This is a zygomatic arch. It is zygomatic arch is verticalized, ostomize. By vertical direction, the zygomatic arch is ostomized. This is the main thing. This is the procedure. I just repeated once again. The zygomatic bone, it is vertically ostomized in this procedure, okay, and anterior to the articular eminence and more inferiorly and more anteriorly to the eminence. More inferiorly and more anteriorly, to the eminence, okay. This is the thing about the Lee Clark's procedure. Now come to the second procedure, as we have to discuss on many things. If you want to know more about it, you can inbox me or give me in the comment boxes, as I have helping many of my juniors and many of my classmates on this procedures also, okay. Other than this, the next point is retractor V-shaped tip. I just make a diagram of it, that how it looks like. See, it looks like this. You have a bifurcation like this, okay. So what, how it is helpful? It does not have a blade. It helps to only retain soft tissues, the soft tissue, or holding tissue, or removing dead tissue. This is the thing we got in the retractor V-shaped tip. This is the diagram. Please ignore my diagram, it is very bad, but like this the instrument look like, okay. The third one, what is maxillary canine occlusion? This is all about your permanent. For example, this is your maxillary teeth. The maxillary canine comes into the occlusal between two incisors, mandibular incisors. This is maxillary canine. This is the occlusion is all about. Okay. Now, what is Pierce patches? I just want to tell you, we are very much familiar with Pierce patches. We are studying from class 12 biology that what is Pierce patches. It is nothing but group of lymphoid tissue or cells in lymphoid tissue in your ileum. Okay, it is nothing but it's a group of lymphoid tissue in your ileum. It is also present in many parts of ileum, but mainly it is nothing just a group of lymphoid tissue. What the line came is at where it is found, means it has been asked that what is the position in the ileum is. What is the position in the ileum is? So the position is right beneath the mucosal layer. I just write it. Right beneath mucosal layer. This is the question. This is the last year question, that where the Pierce patches is. Okay. And here also the Pierce patches, it is also known as pear in Switzerland. Okay, this is an just a name is given. Now the fifth question is your oxygen hemoglobin dissociation curve. I think we all are familiar with the thing that what is oxygen hemoglobin dissociation curve. For example, this is our curve. Okay, here what is it? I just first of all I just want to discuss you all the lines which came in the exam is what first question, what does it demonstrate? Okay, it demonstrate one, partial pressure, and in second, saturation of oxygen. This the thing it demonstrate. For example, this is the limit. Okay, it either shifts to right, it either shifts to left. What happens when it shifts to right? What happens when it shifts to left? First question is what it denotes. This is the answer. Second question is blood hemoglobin with oxygen. Blood hemoglobin with oxygen that is of 90% depend on the partial pressure of oxygen. So what is the question in between? How much percent of oxygen? How much percent of oxygen is there in blood? That will be of 90%. See, one topic, 5 question is there. First, what this demonstrate. Second, how much percent of oxygen is there. Third question, what happen if it shift to left? See, just take as a consideration, if you have a oxygen excess in your body, then it will shift to your left. If there is the oxygen means lower, or there will be a acidic condition in your body, then it will shift to right. I just tell you word by word what it came. Shift to left, it is the acceptance of hemoglobin. Shift to right is the dissociation of hemoglobin. And when it dissociates, first I end up with your acceptance that is seen in your fetal blood. And what is the dissociation is all about? CO2 partial pressure increases, H2O2 increases, acidic condition increases, 2,3 biphosphate glyceride increases. Right. So these are the conditions. I just write down all the conditions over here. CO2 increases, biphosphate group increases, H2O2 increases, and alkaline. Sorry, acidic. And this is alkaline. Fetal blood. Okay, this is the thing. Now the last thing is your salivary gland cells with age. It's nothing but just there is a mucotic cells increases, the amount of mucosa is more, and one more point is that oncototic cells increases, mucotic and oncototic cells increases. That's all in the salivary gland with age. Nothing major question comes into it, just take it into consideration that only the mucotic cells increases. That's all the session of my first one. Yeah, I have discussed. I just take a revision point from the starting. You just see all my videos from the starting. I just want to tell you, first of all, in this session I have discussed about TMJ. I have discussed about your traumatic bone cyst, that is hollow, how we diagnose it. We diagnose it as it is below the mandibular canal. We have only one type of diagnosis, that is a confirmation, that is we have to aspirate. In the second lecture we have discussed about the carious lesion as well as the cusp sizes. In the third we have discussed this 4 point and in the fifth lecture we have discussed this Lee-Clark's procedure, retractor V-shaped tip, your maxillary canine occlusion, Pierce patches, oxygen hemoglobin dissociation, and salivary gland cells with the edge. These all the things are there. Those who have a problem, you can give me in the comment block as well as in my WhatsApp, in my messages, 24/7 in my mail. So I will solve your problem. Thank you and have a nice day, and be updated for the next question answer session. Thank you and have a nice day.